Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 20 practice NCLEX questions. Without the way, let's get started.
Assessment reveals that the fetus of a multigravida client is at +1 station and 8 centimeters dilated. Based on these data, the nurse should first 1. Ask the anesthesiologist to increase epidural infusion rate. 2. Assist the client to push if she feels the need to do so. 3. Encourage the client to breathe through the urge to push. 4. Support family members in providing comfort measures. The correct answer is 3. The urge to push is often present when the fetus reaches plus stations. This client does not have a cervix that is completely dilated, and pushing in this situation may tear the cervix. Encouraging the client to breathe through the urge to push is the most appropriate strategy and allows the cervix to dilate before pushing. Increasing the level of the epidural is inappropriate, as nursing would like to have the client be able to push when she is fully dilated. This may occur quickly with a multigravida client. Comfort measures are important for the client at this time, but are not the highest priority for nurse. The cervix of a 15-year-old primigravida client admitted to the labor area is 2 centimeters dilated and 50% effaced. Her membranes are intact, and contractions are occurring every 5 to 6 minutes. Which of the following should the nurse recommend at this time? 1. Resting in the right lateral recumbent position. 2. Lying in the left lateral recumbent position. 3. Walking around in the hallway. 4. Sitting in a comfortable chair for a period of time. The correct answer is 3. Most authorities suggest that a woman in an early stage of labor should be allowed to walk if she wishes, as long as no complications are present. Birthing centers and single-room maternity units allow women considerable latitude without much supervision at this stage of labor. Gravity and walking can assist the process of labor in some clients. If the client becomes tired, she can rest in bed in the left lateral recumbent position or sit in a comfortable chair. Resting in the left lateral recumbent position improves circulation to the fetus. After a lengthy labor process, a primigravida client gives birth to a healthy newborn boy with a moderate amount of skull molding. Which of the following would the nurse include when explaining to the parents about this condition? 1. It is typically seen with breech births. 2. It usually lasts a day or two before resolving. 3. It is unusual when the brow is the presenting part. 4. Surgical intervention may be necessary to alleviate pressure. The correct answer is 2. Molding occurs with vaginal births and is commonly seen in newborns. This is especially true with primigravida clients experiencing a lengthy labor process. Parents need to be reassured that it is not permanent and that it typically lasts a day or two before resolving. Molding rarely is present if the fetus is in a breech or brow presentation. Surgical intervention is not necessary. Assessment of a primigravida client reveals cervical dilation at 8 centimeters and complete effacement. The client has severe back pain during this phase of labor. The nurse explains that the client's severe back pain is most likely caused by the fetal occiput being in a position that is identified as which of the following? 1. Breech. 2. Transverse. 3. Posterior. 4. Anterior. The correct answer is 3. When a client has severe back pain during labor, the fetus is most likely in an occipito-posterior position. This means that the fetal head presses against the client's sacrum, causing marked discomfort during contractions. These sensations may be so intense that the client requests medication for relief of the back pain rather than contractions. Breech presentation and transverse lie are usually known prior to 8 centimeters dilation, and a cesarean section is performed. Fetal occiput anterior position does not increase the pain felt during labor. The nurse observes a client in a group who is reminiscing about his past. Which effect should the nurse expect reminiscing to have on the client's functioning in the hospital? 1. Increase the client's confusion and disorientation. 2. Cause the client to become sad. 3. Decrease the client's feelings of isolation and loneliness. 4. Keep the client from participating in therapeutic activities. The correct answer is 3. Reminiscing can help reduce depression in an elderly client and lessens feelings of isolation and loneliness. Reminiscing encourages a focus on positive memories and accomplishments, as well as shared memories with other clients. An increase in confusion and disorientation is most likely the result of other cognitive and situational factors, such as loss of short-term memory, not reminiscing. The client will not likely become sad because reminiscing helps the client connect with positive memories. Keeping the client from participating in therapeutic activities is less likely with reminiscing. Which of the following interventions would be most likely to prevent the development of acute respiratory distress syndrome? 1. Teaching cigarette smoking cessation. 2. Maintaining adequate serum potassium levels. 3. Monitoring clients for signs of hypercapnia. 4. Replacing fluids adequately during hypovolemic states. The correct answer is 4. One of the major risk factors for development of ARDS is hypovolemic shock. Adequate fluid replacement is essential to minimize the risk of ARDS in these clients. Teaching smoking cessation does not prevent ARDS. An abnormal serum potassium level and hypercapnia are not risk factors for ARDS. Which of the following nursing interventions would promote effective airway clearance in a client with acute respiratory distress? 1. Administering oxygen every 2 hours. 2. Turning the client every 4 hours. 3. Administering sedatives to promote rest. 4. Suctioning if cough is ineffective. The correct answer is 4. The nurse should suction the client if the client is not able to cough up secretions and clear the airway. Administering oxygen will not promote airway clearance. The client should be turned every 2 hours to help move secretions. Every 4 hours is not often enough. Administering sedatives is contraindicated in acute respiratory distress because sedatives can depress respirations. The nurse is caring for a client who has been placed on droplet precautions. Which of the following protective gear is required to take care of this client? Select all that apply. 1. Gloves. 2. Gown. 3. Surgical mask. 4. Glasses. 5. Respirator. The correct answers are 1, 2, 3, and 4. Gloves, gown, surgical mask, and eye protection/glasses are worn to protect healthcare workers and to help prevent the spread of infection when clients are placed in droplet isolation. Because droplets are too heavy to be airborne, a respirator is not required when caring for a client in droplet precautions. The nurse is administering gastrostomy feedings to an infant after surgery to correct a tracheoesophageal fistula. To prevent air from entering the stomach, once the syringe barrel is attached to the gastrostomy tube, the nurse should 1. Unclamp the tube after pouring a complete amount of formula to be administered into the syringe barrel. 2. Pour all the formula to be administered into the syringe barrel after opening the clamp. 3. Maintain a continuous flow of formula down the side of the syringe barrel. Once the clamp is opened, allow a small amount of formula to enter the stomach before pouring more formula into the syringe barrel. The correct answer is 1. The best way to prevent air from entering the stomach when feeding an infant through a gastrostomy tube is to open the clamp after all the formula has been placed in the syringe barrel. Doing so prevents air from mixing with the formula and thus being introduced into the stomach. Pouring all the formula into the barrel after opening the clamp. Maintaining a continuous flow of formula down the side of the barrel after unclamping the tube, and allowing a small amount of formula to enter the stomach before adding more formula to the barrel permit air to enter the stomach. When an infant with pyloric stenosis is admitted to the hospital, which of the following should the nurse do first? 1. Weigh the infant. 2. Begin an intravenous infusion. 3. Switch the infant to an oral electrolyte solution. 4. Orient the mother to the hospital unit. The correct answer is 1. Unless the infant is in hypovolemic shock. Obtaining a baseline weight is an important first action because the weight is used to calculate the child's fluid and electrolyte needs. The intravenous fluid rate and the amounts of electrolytes to be added to the fluid are based on the infant's weight. The weight also helps determine the infant's degree of dehydration. The intravenous infusion is initiated once the weight has been obtained. The child with pyloric stenosis typically experiences vomiting and is at risk for fluid volume deficit and metabolic acidosis. As a result, oral food and fluids are withheld, and the infant is allowed nothing by mouth. Fluid replacement is given intravenously. Orientation can wait until treatment is underway. Assessment of a prima gravida client in active labor who has had no analgesia or anesthesia reveals complete cervical effacement, dilation of 8 centimeters, and the fetus at 0 station. The nurse should expect a client to exhibit which of the following behaviors during this phase of labor? 1. Excitement. 2. Loss of control. 3. Numbness of the legs. 4. Feelings of relief. The correct answer is 2. Assessment findings indicate that the client is in the transition phase of labor. During this phase, it is not unusual for clients to exhibit a loss of control or irritability. Leg tremors, nausea, vomiting, and urge to bear down also are common. Excitement is associated with the latent phase of labor. Numbness of the legs may occur when epidural anesthesia has been given. However, it is rare when no anesthesia is given. Feelings of relief generally occur during the second stage, when the client begins bearing down efforts. Which of the following would the nurse include in the teaching plan for a 16-year-old prima gravida client in early labor concerning active relaxation techniques to help her cope with pain? 1. Relaxing uninvolved body muscles during uterine contractions. 2. Practicing being in a deep meditative, sleep-like state. 3. Focusing on an object in a room during contractions. 4. Breathing rapidly and deeply between contractions. The correct answer is 1. Childbirth educators use various techniques and methods to prepare parents for labor and birth. Active relaxation involves relaxing uninvolved muscle groups while contracting a specific group and using chest breathing techniques to lift the diaphragm off the contracting uterus. A deep meditative, sleep-like state is a form of passive relaxation. Focusing on an object in the room is part of Lama's technique for distraction. Breathing rapidly and deeply can lead to hyperventilation and is not recommended. A primiparous client has just given birth. The primary healthcare provider has informed the labor nurse that he believes the uterus has inverted. Which of the following would help to confirm this diagnosis? Select all that apply. 1. Hypotension. 2. Gush of blood from the vagina. 3. Intense, severe, tearing type of abdominal pain. 4. Uterus is hard and in a constant state of contraction. 5. Inability to palpate the uterus. 6. Diaphoresis. The correct answers are 1, 2, 5, and 6. Uterine inversion is indicated by a sudden gush of blood from the vagina, leading to decreased blood pressure and an inability to palpate the uterus, since it may be in or protruding from the vagina, and any signs of blood loss, such as diaphoresis, paleness, or dizziness could be observed at this time. Intense pain and a hard contracting uterus are not associated with uterine inversion. The nurse assesses a primiparous client with ruptured membranes in labor for 20 hours. The nurse identifies late decelerations on the monitor and initiates standard procedures for the labor client with this wave pattern. Which intervention should the nurse perform? Select all that apply. 1. Administering oxygen via mask to the client. 2. Questioning the client about the effectiveness of pain relief. 3. Placing the client on her side. 4. Readjusting the monitor to a more comfortable position. 5. Applying an internal fetal monitor. The correct answers are 1, 3, and 5. Decelerations alert the nurse that the fetus is experiencing decreased blood flow from the placenta. Administering oxygen will increase tissue perfusion. Placing the mother on her side will increase placental perfusion and decrease cord compression. Using an internal fetal monitor would help in identifying a possible underlying cause of the decelerations, such as metabolic acidosis. Assessing for pain relief and readjusting the monitor would have no effect on correcting the late decelerations. A 69-year-old client is admitted and diagnosed with delirium. Later in the day, he tries to get out of the locked unit. He yells, "Unlock this door. I've got to go see my doctor. I just can't miss my monthly Friday appointment." Which of the following responses by the nurse is most appropriate? 1. Please come away from the door. I'll show you your room. 2. It's Tuesday and you are in the hospital. I'm a nurse. 3. The door is locked to keep you from getting lost. 4. I want you to come eat your lunch before you go to the doctor. The correct answer is 2. Loss of orientation, especially for time and place, is common in delirium. The nurse should orient the client by telling him the time, date, place, and who the client is with. Taking the client to his room and telling him why the door is locked does not address his disorientation. Telling the client to eat before going to the doctor reinforces his disorientation. The nurse interprets which of the following as an early sign of acute respiratory distress syndrome in a client at risk? 1. Elevated carbon dioxide level. 2. Hypoxia not responsive to oxygen therapy. 3. Metabolic acidosis. 4. Severe unexplained electrolyte imbalance. The correct answer is 2. A hallmark of early ARDS is refractory hypoxemia. The client's PaO2 level continues to fall despite higher concentrations of administered oxygen. Elevated carbon dioxide and metabolic acidosis occur late in the disorder. Severe electrolyte imbalances are not indicators of ARDS. Which of the following complications is associated with mechanical ventilation? 1. Gastrointestinal hemorrhage. 2. Immunosuppression. 3. Increased cardiac output. 4. Pulmonary emboli. The correct answer is 1. Gastrointestinal hemorrhage occurs in about 25% of clients receiving prolonged mechanical ventilation because of the development of stress ulcers. Clients who are receiving steroid therapy and those with a previous history of ulcers are most likely to be at risk. Other possible complications include incorrect ventilation, oxygen toxicity, fluid imbalance, decreased cardiac output, pneumothorax infection, and atelectasis. While making rounds, the nurse finds a client with COPD sitting in a wheelchair, slumped over a lunch tray. After determining the client is unresponsive and calling for help, the nurse's first action should be to 1. Push the emergency response button. 2. Call the rapid response team. 3. Open the client's airway. 4. Call for a defibrillator. The correct answer is 3. The nurse has already called for help and established unresponsiveness, so the first action is to open the client's airway. Opening the airway may result in spontaneous breathing and will help the nurse determine whether or not further intervention is required. Pushing the code blue button may not be the appropriate action if the client is breathing and becomes responsive once the airway is open. A quick assessment upon opening the client's airway will help the nurse to determine if the rapid response team is needed. Calling for a defibrillator may not be necessary nor the appropriate action once the client's airway has been opened. After surgery to repair a tracheoesophageal fistula, an infant receives gastrostomy tube feedings. After feeding the infant by this method, the nurse cradles and rocks the infant for about 15 minutes, primarily to help accomplish which of the following? 1. Promote intestinal peristalsis. 2. Prevent regurgitation of formula. 3. Relieve pressure on the surgical site. 4. Associate eating with a pleasurable experience. The correct answer is 4. The nurse can help meet the psychological needs of an infant being fed through a gastrostomy tube by rocking the infant after feeding. The infant soon learns to associate eating with a pleasurable experience and learns to trust the caregiver. Rocking the infant will not promote peristalsis or prevent regurgitation. Holding the baby will not relieve pressure on the surgical site. However, holding the child right after feeding promotes comfort and pleasure. After teaching the mother of an infant with pyloric stenosis about the disease, which of the following is stated by the mother as a cause, indicates effective teaching? 1. An enlarged muscle below the stomach sphincter. 2. A telescoping of the large bowel into the smaller bowel. 3. The result of giving the baby more formula than is necessary. 4. The result of my baby taking the formula too quickly. The correct answer is 1. Pyloric stenosis involves hypertrophy of the pylorus muscle distal to the stomach and obstruction of the gastric outlet, resulting in vomiting, metabolic acidosis, and dehydration. Telescoping of the bowel is called intussusception. Overfeeding, feeding too quickly, or underfeeding is not associated with pyloric stenosis. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.